Do you know the different phenotypes of PCOS or PMOS? Let's try to find out today. So PCOS was recently changed in its nomenclature to PMOS in the year 2026 May, because it was understood that PCOS is not restricted only to the disease of ovary, nor does it depict that there is only cystic change or any cysts of ovary. It is a whole syndrome which encompasses metabolic and endocrinological changes, and for that reason PCOS has been renamed to PMOS, which stands for polyendocrinology metabolic ovarian syndrome. Polyendocrine metabolic ovarian syndrome. But also we should remember the fact that the pathogenesis, the diagnosis, the criteria, the phenotypes and the management of PCOS or PMOS remains the same. So today we'll try to understand the different phenotypes of PCOS or PMOS because we encounter different types of patients who present to us in different fashion. So it is important as residents that you have to know that this also is a patient of PMOS but belongs to which phenotype, which will help us in better management of the patient. So we basically have four phenotypes: phenotype A, B, C and D. Phenotype A is the classic PCOS or classic phenotype, in which you have all the three criteria present in the patient, that is hyperandrogenism, anovulatory or oligomenorrhea, and your PCOS morphology or Pcos morphology on the ultrasound, that is polycystic ovarian morphology. In phenotype B, you have only hyperandrogenism and oligo or anovulation, that is ovulatory disorder. Okay, so this is also known as the non-PCOS morphology or non-Pcos type of PCOS. In type C or phenotype C, you will have hyperandrogenism and you will have Pcos morphology. So this is there is no anovulatory complaints in this patient. So this is also known as ovulatory type of PCOS. So this is very important to remember, that a patient of PCOS can have ovulatory cycles also, and she fits into the phenotype C of PCOS. Now at phenotype D, which is the last one, in this you will have only oligo or anovulation, that is ovulatory dysfunction, along with the Pcos morphology on ultrasound. So there is no hyperandrogenism seen in phenotype D. So these are the four phenotypes. Also remember that the highest risk of metabolic syndrome or metabolic risk is in type A and B, and least is in type